The way movies depict a heart attack has probably contributed to more deaths than almost anything else I can point to. The man clutches his chest, gasps for air, and collapses to the ground. Theatrical. Obvious. And that's exactly the image people end up waiting for. They sense something isn't right, but it doesn't line up with what they've seen on screen. So they convince themselves it's just indigestion, a strained muscle, or plain exhaustion, and they hold off. I'm Dr. Narita, an internal medicine physician with 15 years behind me. And across those 15 years, the single most frequent thing I've witnessed rob people of their heart tissue, and sometimes their lives, was the stretch of time they spent hoping their symptoms would eventually resemble the television version of a heart attack. Here's something almost nobody has ever laid out clearly for you. During a heart attack, whether you make it through is largely determined in the opening 10 to 15 minutes, well before you ever set foot in a hospital. And within that window, there are precisely 3 actions you can take that genuinely alter the outcome. Not fuzzy suggestions, 3 concrete steps. 1 buys you precious time. 1 slows the very process that's destroying your heart tissue. And 1 keeps that heart functioning while rescue is on its way. Before you scroll past, thinking the answer is obviously call 911. Sure, everybody knows that much. Stick with me a moment. Phoning for help is indeed the first move. But there are 2 specific errors people make while doing exactly that, errors that end up costing them dearly. And layered on top of that call are 2 more techniques almost nobody has ever walked you through. By the time we're finished here, you'll know precisely what to do and in what sequence, whether it's happening to you or to someone sitting beside you. Because on the day this actually unfolds, there won't be time to search it up. You'll either act on what you already know or you'll freeze. My mission over these next 20 minutes is making certain you already know. And honestly, this is the exact territory my second career has been built around. Helping people remain strong and self-sufficient well into their 70s and 80s instead of gradually surrendering their bodies to something they never saw coming. I've distilled everything I share with my own patients into a single, straightforward plan. What to eat, the daily routines worth keeping, the warning signs never to brush off, all bundled into one resource. It's already helped thousands of people build their best years after 60. If that interests you, the link sits right on your screen. Nothing to jot down, nothing to memorize. It's all there waiting. Now, to grasp why these 3 techniques actually work and why sequence matters so much, you need to see what's truly unfolding inside your chest the moment a heart attack strikes. Once you understand that, the entire plan will click into place and stay with you for good. Your heart is muscle tissue, and like every muscle, it depends on a constant flow of oxygen delivered through its own small web of arteries running across its surface, the coronary arteries. A heart attack occurs when one of those arteries suddenly seals shut, and nearly always the culprit is a blood clot. Here's how it happens. A fatty buildup lining the artery wall ruptures, and your blood responds the way it responds to any injury, by forming a clot to patch the tear. Except inside that constricted artery, the clot doesn't simply stop the bleeding. It plugs the passage entirely. The instant that happens, the section of heart muscle relying on that artery is cut off from oxygen. Starved tissue doesn't sit around patiently. It starts dying. Here's the phrase I want etched into your memory. Time equals muscle. The longer that artery remains sealed, the more heart tissue you lose, and most of that loss is permanent. Muscle that dies within the first hour never regenerates. You won't recover it next week or next month. So everything, every single factor, boils down to one question. How much heart tissue can you preserve until someone manages to reopen that artery? And it turns out 3 specific things determine that answer. First, how quickly the artery gets reopened. Second, how fast the clot continues expanding while you wait. Third, how much strain your oxygen-starved heart is enduring in the meantime. 3 factors. And here's the encouraging part, because it hands you real power. You have direct influence over all 3. That's precisely what these 3 techniques target. Each one attacks one of those factors head-on. Reopen the artery faster, halt the clot's growth, and lighten the load on the heart. Hold on to those 3 jobs and you'll never forget what needs doing or the order it needs doing in. Let me give this a human face, because I think of this man every time I teach this material. I'll call him Howard, 66, retired, the type of man who never wanted to make a scene about anything. One morning around 4 a.m., he woke certain he was dealing with a rough case of heartburn, a dense, full sensation right in the middle of his chest, as though something heavy were resting on him. He popped an antacid. Nothing changed. His left arm throbbed faintly. He felt clammy, and his stomach turned uneasy, but there was no crushing pain. He wasn't gripping his chest the way actors do on screen, so he told himself it would pass. He didn't want to rouse his wife over what he assumed was minor indigestion. He settled into his recliner to ride it out. By the time she came downstairs and discovered him pale and drenched in sweat, and they finally reached the hospital, nearly 3 hours had slipped by. Howard survived. I want to be upfront about that. But he lost a substantial portion of his heart muscle during those 3 wasted hours. Tissue he'll never get back. He now spends his retirement managing heart failure, gasping for breath on the short walk to his mailbox, juggling a handful of daily medications. Keep Howard in mind, because by the end, I'll tell you about someone who lived through an almost identical morning and walked away with a completely different future. The entire difference came down to those first few minutes. So before we even reach the 3 techniques, you first have to be capable of recognizing this thing in the first place, because you can't respond to a heart attack you've already convinced yourself isn't happening. And recognition is exactly where most people, including plenty of my own patients over the years, stumble. Forget the movie image entirely. Most heart attacks don't announce themselves with a dramatic fall. They creep in quietly. The most common warning is discomfort centered in the chest, though people almost never describe it as pain. Instead, they call it pressure, tightness, a squeezing sensation, a heaviness like a weight bearing down, or a band cinched tight around the ribs. It may ebb and flow in waves, and it frequently radiates outward, into one or both arms, classically the left, but also up into the jaw or neck, around toward the back, or down into the upper abdomen, which is exactly why so many people swear it's just heartburn. Layer on a cold sweat, shortness of breath, nausea, lightheadedness, or an inexplicable wave of exhaustion that doesn't match the effort you're putting in, and you've got the genuine face of a heart attack. And I need to state this directly, particularly for the women watching and for anyone living with diabetes. Your heart attack is more likely to take the quiet form. Women more commonly experience shortness of breath, nausea, jaw or back pain, or a deep bone-level fatigue without any obvious chest-clutching moment at all. And people with diabetes can have nerve damage that mutes warning pain, meaning a heart attack in a diabetic patient can be nearly silent. Over 15 years, I've watched far too many people, women especially, delay care because what they felt didn't match the picture in their head. So here's a simple rule to live by. If something feels deeply wrong in your chest, your upper body, or your breathing, and it isn't fading, treat it as a heart attack until a trained professional says otherwise. You're permitted to be wrong. You are not permitted to wait. There's one more distinction worth making here, because people constantly confuse these 2 things. A heart attack is a plumbing failure. An artery gets blocked, and the person is typically awake, talking, frightened. Cardiac arrest is an electrical failure. The heart's rhythm suddenly spirals out of control and the heart stops pumping altogether. That person collapses, becomes unresponsive, and stops breathing normally. A heart attack can escalate into cardiac arrest, which is exactly why every minute counts so heavily. I'll walk you through precisely what to do if someone actually collapses, since that demands a different response, and you genuinely need to know both. But for now, the 3 techniques I'm about to lay out are meant for someone who is conscious and exhibiting those warning signs. Technique number 1, call 911 without delay. Yes, you've heard this 1,000 times before. But how you make that call is precisely where people forfeit precious heart muscle. And this technique addresses the first factor directly, reopening that artery as quickly as humanly possible. Here's what most people fail to grasp about that phone call. The clock that matters most for your heart isn't the moment you finally arrive at the hospital. It's the total stretch of time that artery remains blocked, start to finish. Calling 911 is the fastest way to shrink that total, though not for the reason you'd expect. When you call an ambulance, treatment doesn't begin once you're wheeled through the emergency room doors. It begins the instant paramedics reach you. They can attach an ECG right there in your living room, confirm it's a heart attack, and radio ahead, so the hospital's cardiac team is already gowned up and waiting before you even arrive. The American Heart Association has documented for years that patients arriving by ambulance get treated faster than those who walk into the ER unassisted, because the entire system is already mobilized on their behalf. The benchmark hospitals aim for is reopening that blocked artery within 90 minutes of arrival. Calling early and arriving by ambulance is what makes hitting that target achievable. Now, the 2 mistakes, because these are exactly what cost Howard so much. The first is simply hesitating, telling yourself you'll wait a few more minutes, that you don't want to inconvenience anyone, that you'd feel foolish if it turned out to be nothing. Let me lift that worry off your shoulders right now. As a physician, I can tell you paramedics would infinitely rather respond to a false alarm than show up too late. That's the job, and they mean it sincerely. Here's the harder truth. The first hour of a heart attack is also when you're at the greatest risk of slipping into one of those lethal rhythms I mentioned, the kind that stop the heart cold. The ambulance carries the one device on the planet capable of shocking your heart back into rhythm, a defibrillator. Staying home and waiting means that life-saving equipment is nowhere near you. The second mistake is driving yourself or letting a family member drive you. Please don't. If your heart tips into that dangerous rhythm while you're behind the wheel, you could lose consciousness in the middle of traffic, turning one emergency into two, with no equipment and no trained hands anywhere in the vehicle. Inside an ambulance, you're already sitting in a moving emergency room. So the move is beautifully simple. Sit down, dial 911, state clearly, "I think I am having a heart attack," and stay on the line. Use that exact phrase. It tells the dispatcher to send the correct team and to start guiding you through what comes next, including the second technique. Quick note before I continue, and then right back to it. If this is the kind of no-nonsense, straightforward health information you wish your own physician had time to sit down and give you, do me a small favor. Hit subscribe and tap like while you're at it. It genuinely helps this reach more people before the day they actually need it. And drop a comment. Tell me if you or someone close to you has ever had a scare like this. I read every one, and they shape what I cover going forward. All right, you've made the call. Here's the very next instruction the dispatcher will likely give you. Technique number 2, if it's on hand and you're able to, chew one regular strength aspirin. This technique targets the second factor, the clot actively expanding inside your artery while help is en route. Remember, what's blocking the artery is a blood clot, and a clot isn't some finished, solid object just sitting there. It's still forming, still recruiting more of the tiny cells called platelets, whose entire purpose is clumping together to stop bleeding. In a heart attack, that clumping is happening in the worst possible location, sealing your artery tighter by the minute. Aspirin steps directly into that process. It makes your platelets far less sticky, which can slow the clot's expansion and, in some cases, keep the artery from sealing off completely before help arrives. And the evidence backing this isn't thin or shaky. A landmark study called ISIS-2, published in The Lancet back in 1988, found that a single dose of aspirin given during a heart attack reduced the risk of death by roughly 23% from one tablet taken at the right moment. Now for the specifics, because they genuinely matter. It should be a regular strength, 325 milligram tablet, or, if that's what you have on hand, 4 of the low-dose 81 milligram baby aspirins, which add up to about the same amount. And you chew it. Don't swallow it whole. Chewing breaks it down and gets it into your bloodstream far faster, in minutes rather than much longer. And in a heart attack, minutes are the entire game. This is exactly why your 911 dispatcher will typically ask whether you have aspirin at home and instruct you to take it, so let them guide you through it. But I have to draw clear boundaries here, because aspirin isn't right for everyone. Skip it if you know you're allergic. Exercise caution if you've been diagnosed with a bleeding disorder, an active stomach ulcer, or if you're already taking prescription blood thinners. And if you simply aren't sure, that's precisely what the dispatcher and paramedics are there to sort through with you in real time. And hear this next part clearly, because it's where people get themselves into genuine trouble. Aspirin is the second technique. It is not the first, and it is never, ever a substitute for making the call. Chewing an aspirin and then lying down to see if it resolves things on its own without calling for help is a fatal mistake I never want you to make. The aspirin buys a bit of time. The ambulance and the hospital save your life. So, one regular aspirin, chewed after you've called, provided you have no reason not to take it. That's the entire rule. Technique number 3, stop everything, sit down, and bring your body to as calm and still a state as you possibly can. This one directly targets the third factor, how hard your oxygen-starved heart is being pushed to work. Consider what's actually happening. A section of your heart muscle is starving because its oxygen supply has been severed. Now think about what your heart does the moment you move around, climb stairs, get agitated, or panic. It beats harder and faster, demanding even more oxygen. But the supply line is cut off. So every ounce of extra work you demand from your heart in that moment is work it simply cannot afford. That unpaid debt translates into more damaged muscle and a greater chance of the rhythm turning dangerous. So your single job here is the exact opposite of exertion. Your job is to lower the demand. The moment you suspect something's wrong, stop whatever you're doing and settle into a resting position. For most people, that means sitting down, leaning back slightly, somewhere safe in case you faint. If you're very short of breath, sitting upright tends to be easier than lying flat. Loosen anything tight around your neck or waist. Then focus on your breathing. Slow and steady, in through the nose, out slowly. I know that's difficult when fear has taken hold, and being afraid here is entirely natural. But that surge of adrenaline from panic drives your heart rate and blood pressure up at precisely the worst moment, while slow, deliberate breathing helps pull some of that back down. If someone's with you, have them stay close and help keep you calm and still. If you're alone, make your way to the front door first, unlock it, then sit down nearby. That way, paramedics can reach you even if you're unable to get up and let them in. That one small step has saved lives, and people almost never think to do it. Now, I have to debunk a dangerous myth that resurfaces online every couple of years, because someone always asks me about it. You may have come across a forwarded message about so-called cough CPR. The claim being that if you feel a heart attack coming on while alone, you should cough forcefully and rhythmically to somehow keep yourself conscious. The American Heart Association has addressed this directly. It does not work for someone experiencing a heart attack alone, and worse, fiddling with it instead of picking up the phone can cost you the exact time that would otherwise save your life. So forget the coughing. The real third technique is simple and proven. Stop moving, sit down, breathe slowly, unlock the door, and let the help already on its way come to you. And I promised I'd cover the other scenario, because one day you might be the one who has to act on someone else's behalf. What if the person actually collapses? You reach them and they're unresponsive, not breathing normally. That's no longer a heart attack you can talk someone through. That's cardiac arrest. The heart has stopped, and right now, you're that person's single best chance of survival. 2 steps, and you don't need a single day of training to perform either one. First, call 911 and put it on speaker so your hands stay free, or have someone else make the call. Second, start compressions. This is hands-only CPR. Place the heel of one hand at the center of the chest, your other hand stacked on top. Lock your elbows and push down hard and fast, roughly 2 compressions every second, and don't stop. You're performing the pumping action the heart can no longer do for itself. The American Heart Association has shown that immediate bystander CPR can double, even triple, a person's odds of surviving cardiac arrest. And if there's an automated external defibrillator nearby, an AED, the kind mounted on walls in airports, gyms, and shopping centers, send someone to retrieve it. It will walk you through every step out loud, and it won't deliver a shock unless one is genuinely necessary. You cannot make the situation worse. In cardiac arrest, the only wrong move is doing nothing at all. There's one more thing I want to leave you with, something nobody ever mentions. The people who come through a heart attack in the best shape are the ones who prepared before it ever happened. So tonight, handle a few small things. Keep a bottle of regular aspirin somewhere you and your spouse could locate in the dark within 10 seconds. Make sure your house number is visible from the street so an ambulance isn't searching for you. If you already have a heart condition, know exactly where your records and medication list are kept, and have an honest conversation with the people you live with about these warning signs and this.